All right, now if we cut the heart open and actually look at the chambers. This space is the right atrium, right ventricle, left atrium, left ventricle. Now, the right atrium is collecting blood that is passed through all of your body except the lungs. And there are 3 blood vessels that deliver blood to the right atrium. If the blood is coming from the top of your body, limbs, upper torso, head and neck, all of that blood is collected by the superior vena cava. Vena cava means big vein. Cavernous vein. And so here is the superior vena cava, and blood is flowing into the right atrium from the superior vena cava. If blood is coming from your abdominal cavity and your lower limbs, that blood is coming into the right atrium through the inferior vena cava. The blood that actually passes through the heart muscle itself, that blood is collected by a vein called a coronary sinus. Sinus, you know, you got these kind of sinuses. This is a different kind of sinus. Sinus means a thin-walled vein. The coronary sinus, this is this big vein on the back side of the heart. Notice that the coronary sinus is in the coronary sulcus. The coronary sulcus is the groove. The coronary sinus is this vein. Now, this blood that's passed, that's coming from the top of your body, from the bottom of your body, and that's passed through the heart muscle itself, through the myocardial, this blood is oxygen poor because it's dropped off the oxygen to all of your other tissues and picked up carbon dioxide. Right? Sometimes it's called deoxygenated blood. A better term is oxygen poor blood. There's still a little oxygen in there, but there's not much. Okay, from the right atrium contracts and sends blood into the right ventricle, but it passes through something called a tricuspid valve. You can't see it because this is the aorta, but there's a wall between the right atrium and the left atrium. It's a little thin piece of myocardial called the interatrial septum, like your nasal septum. But you can't really see it from this diagram. But you see that dent right there? Right there, the dent. See, here's the opening from the superior vena cava. Here's the opening from the inferior vena cava. Here's the little opening from the coronary sinus. And then, of course, this is the tricuspid valve. That little dent is called the fossa ovalis. Remember with bones, fossa means dent, right? You had the olecranon fossa on the bottom of your humerus, and when you straighten your elbow out, that's where the olecranon process went into. When the baby, when you were in utero, okay, you didn't need to send blood to your lungs. In a baby, it's a hole called the foramen ovalis. And so when blood came in the baby's heart, when blood comes into the right atrium, or the fetus's heart, I should say, not the baby's heart, the fetus's heart, this blood bypasses, for the most part, the right ventricle because you don't need to send the blood to the lungs. It goes through that hole over to the left atrium, to the left ventricle, and then out to the baby's body. Because where's the blood being oxygenated? The fetus's blood. From the mom, from the umbilical cord, right? Does that make sense? Okay. So, when a baby is born, one of the first things that happens is a little flap of tissue closes. When that baby takes its first breath, a little flap of tissue closes and eventually fuses to form a little dent, the fossa ovalis. Now, a lot of times you'll hear about babies being born with holes in their heart. There are many places that this can happen, but this is one of the most common places. If it's here, what they'll do is most of the time that will eventually close itself up. Sometimes, if not, as the baby gets older, they'll have to go in for surgery. All right, so when you dissect the sheep parts, look in that right atrium and see if you can probably feel it before you can see it. See if you can feel for that little dent, that fossa ovalis. Right atrium through the tricuspid valve into the right ventricle. Now, all of the right ventricle has these little ridges in here. They're called trabeculae carneae. Specialized trabeculae carneae are these little muscles called capillary muscles. So all of the ridges, the muscular ridges inside, in fact it's inside both ventricles, not just the right ventricles, are called trabeculae carneae. And then you have specialized trabeculae carneae that are called papillary muscles. Now, why are they specialized? Because the papillary muscles are attached to these little cords, these little connective tissue filaments of the valve called the chordae tendineae. Here's the flaps of the tricuspid valve. They're called the cusps or the flaps. Then they have these little cords that are attached to these papillary muscles. All right, so all the ridges are the trabeculae carneae. These ones that happen to be attached to the chordae tendineae are called papillary muscles. Don't get your papillary muscles mixed up with your pectinate muscles. In the right ventricle only, not in the left ventricle, but there's a little ridge called a moderator band. And when we start talking about the cardiac conduction system of the heart, this will come into play. And then, of course, in between the ventricles, between the right ventricle and the left ventricle, you have the intraventricular septum. Now, that's a lot easier to see. It's very thick. So you had an interatrial septum, which is really thin. It's kind of back here somewhere that you can't see. But you can see the intraventricular septum. Very thick wall of myocardial. Cool.
So the ventricles are much bigger.
Ventricles are much bigger. They're much bigger, and the walls are much thicker. They have to generate a lot more pressure. Atria just have to get the blood to the ventricles, so they don't have to be that strong. But the ventricles have to get, the right ventricle has got to get blood to the lungs. The left ventricle has got to get blood to the rest of the body. All the way up to the top of your head, to the end of your fingers, and end of your toes, and back. Now, when the right ventricle contracts, first thing that's going to happen is this valve is going to shut, and blood is going to be shunted eventually to the lungs. This little area here, I don't care that you know this, but in case they talk about it in lab, this is called the conus arteriosus. That's right here. But the point is, the blood is going to go this way, and it's going to go through a valve called the pulmonary semilunar valve. Once it goes through the pulmonary semilunar valve, it's going to go into what's called the pulmonary trunk. Through this valve into this thing right here called the pulmonary trunk. And the pulmonary trunk divides pretty quickly into the right and left pulmonary arteries. Where arteries divide to form smaller arteries called arterioles, and arterioles divide to form capillaries. And so eventually the blood that is going into the pulmonary arteries gets to the pulmonary capillaries. And at this point, in those pulmonary capillaries, it's able to pick up oxygen from the lungs and drop off carbon dioxide. Now, once the blood has picked up oxygen in the pulmonary capillaries, dropped off its carbon dioxide, pulmonary capillaries form pulmonary venules, which eventually form the right and left pulmonary, and actually there's pairs of them. We'll just call them the right and left pulmonary veins. And so you can see two of them over here. These are the pulmonary arteries. These are the pulmonary veins. And there's another two on the other side in the back. Arteries carry blood away from the heart. Veins carry blood back to the heart. It has nothing to do with the oxygen. But you've always been taught arteries carry oxygenated blood, veins. On the systemic side of your body, that's true. In the systemic circuit, that's true. The pulmonary circuit, it's not. All right. Now, the pulmonary veins bring the blood back to the left atrium. From the left atrium, the blood passes through the bicuspid valve, also called the mitral valve. You can call it either one, the bicuspid valve or the mitral valve. From the left atrium through the bicuspid valve into the left ventricle. So here's the left atrium, here's the bicuspid valve, here's the left ventricle. Now, notice that the left ventricle has basically the same thing as the right ventricle. It's got the trabeculae carneae muscular ridges. It's got the specialized ones called the papillary muscles. It's got the chordae tendineae, the bicuspid valve attached to the papillary muscles.
So does the papillary muscle, is that what helps the valve open and close?
It doesn't help it open and close. It keeps it from prolapsing.
Open more backwards.
Uh-huh. Yeah. You've heard of mitral valve prolapse, right? Okay. What happens is, when the ventricles contract, the cusp, the flaps of these valves are pointed down. And when the ventricles contract, the blood is forced upward, and that normally closes those valves. Without these cords, and without these papillary muscles, that valve would just flap back open, and instead of blood flowing out of the heart, it would go back up into the atrium. That's what we mean by prolapse. Now, in some people's hearts, the valve is shaped a little bit funny, or it's not working correctly, and so the valve does prolapse, mitral valve prolapse. It's one of the most common causes of a heart murmur. When you listen to the heart, you hear, and you think, oh, I'm hearing the heartbeat. What you're hearing is the blood hit the valves, as the valves close. And so in the case of a valve prolapse, a mitral valve prolapse, you hear, from the left ventricle, the blood goes through, and you can barely just see it peeking out back here. The aortic semilunar valve into the aorta. So this large blood vessel here, that's the aorta. And it actually goes up and over and down through your chest. You can see it's coming out behind the heart here, and all the way down to where it splits into the right and left common iliac arteries. So eventually the aorta divides into arteries, arteries divide into arterioles, and the blood goes into the systemic capillaries. At which point, it drops off the oxygen and picks up the carbon dioxide. And then that blood eventually is collected, depending on where it's coming from, either by the superior vena cava or inferior vena cava, or if it passed through the coronary arteries, through the heart muscle tissue itself, the coronary sinus. And of course, those vessels all take the blood back to the right. Okay, now, a couple of other structures that I want you to look at. And I'll do it. See this little thing right here? This is another one of those things that's open during fetal development but closes after the baby is born. In the adult heart, it's called the ligamentum arteriosum. But again, this is another way. Remember I said that most of the blood that comes in the fetus, most of the blood that comes from the right atrium goes through the foraminal valves over to the left atrium. But some blood does actually get here and go up into the pulmonary trunk. Again, it's not going to do the baby any good to send blood from the pulmonary trunk to the lungs because you can't pick up oxygen there. So there's actually a little vessel that also helps bypass the lungs. And the blood that gets into here actually goes into the aorta. But that also closes and forms the ligamentum arteriosum in the after-baby's born. Okay, so now we know that the blood goes from the atria to the ventricles. And if you look at the walls of the atria, they're much thinner than the walls of the ventricles because all they have to do is go in there. You know, the only time they really have to work hard is if you're standing on your head. So unless you're a circus performer, you know, they have a pretty easy life. The ventricles, however, of course, the right ventricle's got to get the blood to the lungs, the left ventricle's got to get the blood to the rest of your body. And if you look at the outer wall of the right ventricle, it's thinner than the outer wall of the left ventricle because the left ventricle has to pump the blood further. In skeletal muscle, we talk about the endomysium, the perimysium, the epimysium. You still have some connective tissue in between the cardiac muscle cells as well. The big thing that this does is that, remember that the cardiac muscle cells are not attached to muscles, they're attached to each other. And so it helps distribute those contraction forces so that the forces work together, each muscle cell works together. It also is a place for blood vessels and nerves, just like the perimysium is in skeletal muscles. Now, where the valves are, if you cut the pulmonary trunk and the aorta and the two atria off and you look at the heart, you see the 4 heart valves. All of that connective tissue that basically attaches those heart valves together is called the fibrous skeleton. This would be where the pulmonary trunk would come off. This would be where the aorta would come off. And then the 2 atria would be sitting here. The right atrium would be right there, because that's the tricuspid valve, and the left atrium would be here, that's the bicuspid valve.
The ventricles at the end.
Yeah, the ventricles are underneath there. Now, this does a lot of things. One of the big things that the fibrous skeleton does is it is what's called an electrical insulator. So that fibrous skeleton is basically right through here. And I think I've said this before, you want all of the cardiac muscle cells of the atria to contract together, but not at the same time that the ventricles contract. So you want the atria to contract first, and the ventricles to contract after that. And so this electrical insulator basically allows the electrical signal, which we'll talk about a little later, to only go through one spot, one particular spot, from the top of the heart to the bottom of the heart. And so basically it insulates all the other cells, and it insulates all the atrial cells from the ventricular cells. If not, remember that all of these cardiac muscle cells are connected by gap junctions, by those intercalated discs that have those gap junctions. And once one cell contracts, or once one cell begins to depolarize, all of the rest of them do too. And so if you didn't have this there, all of the cardiac muscle cells would all contract at the same time. And that would basically stop the flow of blood. And notice you can see there's a difference between these valves and these valves. The cusps, or the flaps, of the semilunar valves point upward like this. The cusps of the AV valves, atrioventricular valves, point down like this. So when you look at them, you're seeing the top, the rounded surface. This is convex, this is concave. Does that make sense? And the reason is, these valves open and close according to how the blood hits. And how, if the cusp is set like this, and blood begins to flow back, the valves shut. And that's how these work. Ventricles contract, these valves open. Ventricles relax, blood begins to flow back into the pulmonary trunk or the aorta, and the valves catch it, and they shut. These valves, because they're pointed the other way, ventricles contract and they close, and then these valves open. So when the ventricles contract, the AV valves, the flaps are down like this. As the blood is pushed upward, those valves close. And when those close, then the ventricles continue to contract, and these valves, which are set this way, go open. So that's why the cusps are pointed in different directions. Better diagram. Ventricle is relaxed, it has to be the left ventricle. You see that the AV valve is open. Blood is flowing from the atrium into the ventricles. The semilunar valve is closed because the cusps are pointed this way. When the ventricle begins to contract, blood is pushed up, it's caught by these flaps that closes the AV valve, and then as the pressure continues to increase, it opens the semilunar valves. One of the most common causes of a heart murmur, an odd sound in the rhythm of the heart, is what we call microvalve prolapse. If any of the stuff is damaged, as the left ventricle contracts, that microvalve actually prolapses up, and blood goes up back up to the atrium instead of out feeding